All right. Hello, medical terminology students. This week, again, we have two chapters that we're going to go over. These two chapters kind of go hand in hand, but not necessarily. So, chapter 13, we're talking about the respiratory system. And then the next one, I think it's chapter 21, but it has to do with radiology. So, granted, radiology is more commonly seen in the musculoskeletal system, but that one was a lot more complex than these. And then on top of that, you get chest X-rays all the time to check for pneumonia. So, yeah. All right, it is what it is. Let's get going with the respiratory system. This chapter starts on page 425 of your book. Here are the organs that are involved in the respiratory system. And yes, it starts all the way up here. You have what we consider the upper respiratory system, which is going to be here on, well, like your chest on up. And then anything in your trachea, bronchioles are going to be the lower respiratory system. Respiratory system functions. Obviously, the whole system itself has all these functions, but each component is actually going to have their different functions. So you guys can read through these. So we've got our upper respiratory tract, and you can see here's our upper respiratory tract, and these are the organs within the upper respiratory tract. Meatus is actually going to be the nasal opening. Anything that has an opening, it refers to the meatus is the term for that. So we have the functions of the nose. I'll let you read the functions of the nose on your own. Parts of the pharynx. The pharynx is where we swallow down at. And if you take a look at the parts, we have a nasopharynx, an oropharynx, and a laryngopharynx. That is like two areas put together. So nasal means nose, pharynx is going to mean the throat. And so that section in there is kind of a combination of the nose and the throat together. Going on down would be the mouth and the throat. And then further on down, your larynx and the throat. That's what those mean. Parts of the oropharynx, you can see we've got our tonsils, our uvula, and we already kind of talked about nasopharynx and oropharynx, but this is where you would change it into an adjective form. So if we have nasopharynx, then we have nasopharyngeal. Same concept for oropharynx. It's going to be the same, oropharyngeal, and then pharynx would be the pharyngeal. Parts of the larynx, there's several parts of the larynx. I don't need you to know this, but if you look at the difference between the glottis and epiglottis, obviously epi means above. And if you look on your little diagram, you've got your glottis and then the epiglottis, which is right above. So, functions of the larynx, I'll let you guys read the functions of the larynx. You can do that on your own. And then now we go to the lower respiratory tract. You can see that we've got our larynx, which they consider part of the lower respiratory tract. And then we've got our bronchus, which are two bigger tubes. And then you have the bronchioles, which branch out further, just kind of looks like a tree if you look at it. And then we have all the way down to our alveoli, which are alveoli are like little sacs at the ends of our lungs that have to do with gas exchange. There's the functions of our respiratory tract. I'll let you read these on your own. And then here's some other the parts, or not really organs, but components of the respiratory system. We have our diaphragm. We have the mediastinum. And then a fissure is kind of like a narrow cleft. That's what's in between things. Like you have fissures in your brain because there's a narrow cleft in your brain. You have them in your lungs because you have different lobes of your lungs, and there's like a fissure that connects the two. So that's what that means. Some word analysis: define each medical term, describe its function in the respiratory system. to page 432. You'll be able to see those. You can look them up in your book and write them down or put them on flashcards. And then we have the pleura, which if you do on page 432 as well, you can read about the visceral pleura versus the parietal pleura and what the pleural cavity is, the functions of the pleura. Again, it's just another component of the lungs and the area of the lungs. Here's your bronchus again. You look at it, it looks just like a tree. Looks like you're like a tree going through the leaf changing part in autumn or fall. Again, I don't need you to know so much about these. You will in anatomy and physiology, that's for sure. And then structure and function of the bronchioles and the alveoli. This is going to be on page 433. There's a figure 1311, which talks about the bronchioles and the alveoli. You can see the alveoli are like these little round sacs, and that's where the gas exchange occurs, where you breathe in oxygen, breathe out the carbon dioxide. That gas exchange occurs in that very, very, very small little ball, and you have many, 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 many of them in your lungs. So let's talk about respiration. The term respiration, if you look at here, it's the concept of both inspiration, breathing in, and breathing out. So that full process is called respiration, whereas exhalation, we're expiring out, inspiration, expiring in, and so this is where it kind of comes together. When you have the hiccups, that's literally just a spasm or reflex of your diaphragm. And then yawning is due to hypoxia. So when you have hypoxia, and hypoxia can be caused from even just relaxing, and your body's not breathing as much because it's relaxing down, such as when you're tired and you start to yawn, that's your body's way of saying, hey, I need more oxygen in me. Let's talk about the disorders of the respiratory system. URI. Anybody hear of this? I'm sure a lot of people have. URI, upper respiratory infection. And then we have allergic rhinitis. Rhine means nose. Sinusitis. Sinus means our sinuses. You have sinuses like right here, sinuses in here. So if you ever get a sinus headache right in here, that's what that is. Like behind your eyeballs, in your cheeks. It feels like somebody punched you in the cheek. And then epistaxis, that's just a term for a nosebleed. So here's some other disorders of the pharynx and the larynx. I will let you read these, but take a look at the last 5 of them. They all have the suffix itis on them. So obviously itis, you should know by now what itis means. Itis means inflammation. It's going to be inflammation in just wherever it's at. So if I have sinusitis, I've got inflammation in my sinuses. If I've got laryngitis, I've got inflammation in my larynx. If I have laryngotracheal bronchitis, I've got inflammation in all of those areas. All right, define the following root words and elements. I'll let you do that. So mucus, purule, pus, and then nays and rhine, nose. All right, so we've got some other definitions here. Aphonia, that's when you lose your voice. The laryngo, oops, sorry, I spelled it wrong. It should be laryngotraco, not treach. Laryngotracheobronchitis, otherwise known as croup. And then stridor. Stridor is that real high-pitched squeal, and that's indication that that part of your throat, your larynx or your bronchus, it's closing up, and it's like a whistle going through that. That can be actually quite dangerous and can be an emergency situation. Some respiratory disorder. All right, so we have dyspnea. If you take it apart and look at dys means difficult or abnormal, and then pnea means breathing. And then we have tachypnea, not tachypnea. Tachypnea means it's going to be fast, rapid. Tachy means fast. Bradypnea means slow. And the fast and slow have to do with how many breaths per minute you're taking. Normal is 12 to 20. So if you have tachypnea, typically it's going to be over 20 respirations per minute. If you have bradypnea, then it's going to be less than 12. Cyanosis, cyan means blue, and osis means condition. Apnea, and if you break it down, A means no, not, or without, and then pnea means breathing, so without breathing. Sneezing. And then I want to bring you to hyperpnea and hypopnea, and I want you to know the difference between this, or not just tachypnea, bradypnea, hyperpnea, and hypopnea. So hyperpnea is actually when we do excessive breathing, it means it's deep. It means I'm going not fast. There's a difference. Fast is tachypnea. Hyperpnea is those deep breaths. And then hypopnea is now the opposite of those excessive deep breaths. It's shallow, not slow. So make sure you know the difference between tachypnea and hyperpnea, bradypnea and hypopnea. And then eupnea, eu means normal. And then we have hypoxia. Hypo means low, and actually hype means low, ox means oxygen, and ea means a condition of, so a condition of low oxygen. Some other terminology that you're going to see: expectorate, hemoptysis, phlegm, disorders of the lower respiratory tract, acute or chronic bronchitis, bronchiolitis, pulmonary emphysema, chronic airway obstruction, chronic airway obstruction, COPD, chronic obstructive pulmonary disease is what that means. Bronchiectasis, bronchial asthma, cystic fibrosis, and pulmonary edema. All right, so let's see, where am I at? Just take a look, kind of guide you into the right place of where we're at. And I am now on page 442 in your book, the chart that you'll see. So pneumonia, again, if you break it down, pneumon means lung, ea means a condition, so it's a condition of the lung. Pleurisy, so ISI, inflammation. Most of the time you see itis, but you can have pleuritis, but pleurisy be the same. Pneumothorax, thromboembolism, acute respiratory distress syndrome. This one here, you're just going to see the abbreviation, otherwise referred to as ARDS. Tuberculosis, and then acute respiratory failure. Sometimes you'll see it as ARF. Atelectasis, hemothorax, pneumothorax, empyema, polysomnography, hypoxemia, and idiopathic. Compare and contrast the following terms. Okay, we've got some osis at the end here. So the first one, pneumoconiosis, asbestosis, silicosis, anthracosis, sarcoidosis. All right, pulmonary diagnostic procedures. There are several different types of pulmonary function tests. One is just a spirometer. And then you have what we refer to as a peak flow meter, which again, it's a breathing thing that you do. Arterial blood gases, where they draw blood, but they're not drawing from a vein, they're actually drawing from a deeper artery. It's more invasive. Auscultation is what you would do to listen with a stethoscope. If you've ever had a provider put their stethoscope on your chest or your back and say, take a deep breath, that's what they're doing. They're listening for those lung sounds. And then we have chest x-rays, bronchoscopy, mediastinoscopy, thoracentesis, and thoracotomy. Rhinoplasty. Now, this would be actually doing your nose. It's different than a septoplasty. You have your septum, which is deepened further. A rhinoplasty would be like plastic surgery type of a thing. Cautery. Cautery is used when you have a nosebleed that you can't stop. Immunizations. These are very common to help prevent from viruses that could cause pneumonia or COVID. Therapeutic procedures, obviously these have to do with therapy. So we have mechanical ventilation, endotracheal intubation, which they put the tube down your throat or they put it into your neck. The tracheotomy would be through the neck, or surgical interventions such as a pulmonary resection, a wedge resection, segmentectomy, lobectomy, pneumonectomy, and this would be removing parts or all of the lung. And then for pharmacology, we have decongestants. Many of you guys might be taking those around this time because influenza and COVID and cold seasons are here. Glucocorticosteroids, bronchodilators, expectorants, mucolytics, and antibiotics. And that was it for the respiratory system. The next chapter for this week is going to be chapter 21 that has to do with radiology and nuclear medicine.